Moving to the next part of our meet, I would like to spend some time discussing about the thing which has halted our lives. The word of the year, pandemic. We have with us Dr. Nitin Goswami, who is a student of who is an alumni and was a student of 1990 batch of 1990 batch in JNV Jamnagar. He finished his career in JNV family in 1997. Then he went on doing MBBS and then MD in the field of medicine. He then worked for a while in the Apollo Hospital at Ahemdabad, and uh, and now he's having a personal clinic in Ahemdabad. So I would like to welcome you, Dr. Nitin. Hi.
Yeah, thank you, Akash. I'm audible.
Yeah, you are audible. Yeah, it's a great
Yeah,
pleasure to
thank
have
you.
you. Yeah, so I would like to start this conversation, with the introduction to can you tell us about what is COVID, and how we can get infected, and stuff like that.
Yeah, Akash. COVID is basically a viral infection recently detected just 1 year back, which causing infection in the lungs, leading to viral pneumonia. Person get infected from infected person. In a person who is infected once can infect other person up to 14 days. And also, virus survive on some surfaces for 2 to 4 days. So,
Hmm.
a contaminated surface and a infected person are source of infection for us.
Okay. I've prepared a set of questions for you, and I'd like to ask them. So, what are the typical symptoms that one might observe when he or she gets infected?
Yeah, in early phase of disease, there are minor symptoms like weakness, cold, cough, loss of taste, loss of smell, which may progress to high-grade fever, severe weakness, and sometimes some breathing difficulties in many patients. So it classically looks like upper respiratory or lower respiratory infection, which may lead to some respiratory distress and may lead to death because of respiratory failure.
Hmm. And what would be the medically approved diagnostic tests who can confirm whether someone has COVID or not?
Yeah, ICMR, that is a medical research center of India, has approved two tests. One is RT-PCR, that is called, and another one is rapid antibody test. The sensitivity of rapid antibody test is around 40 to 50%, and RT-PCR is sensitive about 80%. Other supportive tests are CT scan of the chest, which can detect the extent of pneumonia. Blood test like CRP, IL-6, LDH, D-dimer, which indicates complication and extents of the COVID infection in the body.
Okay. Hmm. Okay. And what would be the steps which one can take just when he or she knows that she has COVID-19, they test positive? What would be the
Yeah,
immediate steps?
yeah. If somebody is tested positive, no need to get worried. It's not a very threat to life, but uh, he has to take care of himself. He has to isolate himself. He has to do all necessary tests required by the doctor. Just monitor their health, monitor temperature, monitor pulse, and most important thing is isolate so that he cannot infect other persons in the family or in the community.
And do all of us require, like, all of us who gets positive require hospitalization?
Uh, as I said, the symptoms are minor in majority of patients. So
Mhm.
almost 60 to 70% patients may not require hospitalization. They can get treated by only symptomatic treatment by the treating doctor and frequent monitoring of the blood tests and CT scan and supportive treatments. Only 30 to 40% patients require hospitalization, and out of that, 20% of patients may require specific treatments in this cases.
Hmm. Okay. And now this brings me to the all important questions. There has been this new normal floating around in the country and over the world, and that's necessary. But how can we prevent ourselves in this new normal? Can you suggest some of things?
Yeah, nowadays, as we know, there is no specific treatment for the COVID. So prevention is the only thing that we can take at our part. So First thing is maintain social distancing, avoid crowding, avoid gathering, and then avoid outgoing of the house. First, this thing. If you ever you want to go or you have to go, you have to maintain social distancing of almost 3 to 6 feet between a person to person. Wear a mask while going outside. Uh, Frequently wash hands after touching objects or surfaces and coming out from the outside of the house.
Mm, okay. And there has been a lot of talk around this topic, the next topic that I'm going to bring up. And there has been lots of misinformation spreading. What are the available remedies as of remedies right now, as per the scientific and medical norms?
Yeah, right now there is no specific antibiotic or antiviral treatment available. These are all are supportive treatments just to for
Mm,
fever, multivitamins, vitamin D, vitamin C. Some antivirals are emerging as a treatment choice like favipiravir and remdesivir, but these are selective cases in selective patients are given these treatments.
mm,
Majority of patients who are hospitalized, they are given
mm.
remdesivir, steroids, oxygen supply.
Okay.
Tesunizumab is an injection, which is, I think, anti-inflammatory response. This is only a selective few 4 to 5% patients require this treatment.
Okay. Okay. That was a great set of information. Anyone who needs more information on this matter can talk to Dr. Nitin Goswami. I would like to ask you if there is anything which you want to add as a concludatory remark on this talk.
Yeah, as we know, COVID is a very contagious disease. It can get infected from person to person. So only thing that we can suggest to our alumni or friends that take care, maintain social distance, wear mask while going outside, and frequent sanitize your hand or wash your hand. And if you ever find some symptoms like what I said, symptoms of cold, cough, do not hesitate to get tested. If you get tested early, you can prevent to get infected others, and early treatment can save you from complications.
Okay. Okay. Thank you, sir. Thank you so much for sharing your time and the information with all of us. And I just hope that we all cross this mega hurdle safely. So at the end of the this pandemic, all of us are safe. Let's just hope this.